intraoral sensor image capture using the Dentsply Rin XCP QT sensor holder kit. Objectives are doing an overview of the image capture criteria, reviewing the parallel technique, anterior assembly and positioning, posterior assembly and positioning, bite wing assembly positioning, overcoming challenges, as well as bisecting technique.
For more than 5 decades, Dentsply Rin's XCP film holding system has represented the state-of-the-art in dental radiography. As the dental industry transitions from traditional film to digital radiography, conventional film holding systems are changing to newer, more advanced designs, like the Dentsply Rin's XCP QT Universal Disposable Sensor Holder System. And with digital sensors that are larger and more inflexible than film, positioning is more important than ever. Achieving accurate results is dependent on several key factors. 1. The precise alignment of the film or the sensor to the X-ray beam using an appropriate positioner. 2. The ease of the practitioner in assembling and placing the positioner correctly in the mouth. And 3. The comfort of the patient during the radiographic procedure. This module will illustrate simple positioning techniques that will allow you to realize accurate, distortion-free radiographs each and every time. The XCP family of positioners is specifically designed for use with the extension cone paralleling technique, a radiography technique that offers several important advantages. First, the paralleling technique eliminates the need for you to determine the angulation and positioning of the X-ray tube head in relation to the film or sensor, taking all the guesswork out of positioning. Most importantly, the paralleling technique minimizes dimensional distortion and presents the objects being radiographed in their true anatomical relationship and size. This results in sharper, more accurate radiographs that enable dentists to diagnose and plan better treatments. Please note, during this training module, we will be demonstrating X-ray positioning techniques using a digital sensor and the XCP QT Universal Disposable Sensor Holders. If you are using film, you can apply the same positioning techniques using Rin XCP film holders. To position the XCP QT Universal Disposable Sensor Holders for anterior maxillary teeth, assemble the anterior instrument by sliding the appropriately sized base over the top of the sensor. The top of the base has a tab to keep the sensor secure. Then attach the white periapical bite piece by sliding it up from the bottom, locking the sensor securely. The XCP QT Disposable Universal Sensor Holder System is disposable, single-use, and works with Rin Relax Fit sensor covers. Place the sensor in the center of the mouth and, with the bite piece centered on the incisal edges of the teeth to be radiographed, instruct the patient to close slowly. A cotton roll may be placed between the mandibular teeth and bite piece for patient comfort and to ensure parallel alignment. Once the holder is in place, slide the aiming ring close to the skin surface. Align the tube head of the X-ray unit in close approximation to the aiming ring and center it. You are now ready to take the X-ray exposure. For anterior mandibular teeth, follow these same steps, centering the digital sensor behind the mandibular teeth to be imaged, positioning it as posterior as the anatomy will allow. Placing the sensor into the center of the mouth, where there is more room to accommodate it, will allow better alignment and more patient comfort. With a sensor, it is sometimes difficult to place the sensor parallel to the teeth due to its size and inflexible nature. For patient anatomy that doesn't allow parallel placement of the sensor to the teeth, allow the sensor to find its own spot in the mouth even if it is slightly off parallel. To minimize elongation or foreshortening, adjust the vertical angulation of the X-ray tube head to keep it parallel to the sensor. Minor distortion may result from this, but in some cases it is the only option. To position the XCP QT universal disposable sensor holders for posterior maxillary teeth, attach the white periapical bite piece to the base, already on the sensor, from the side. When changing to the opposite quadrant, the bite piece is removed and reattached to the base on the opposite side, keeping the sensor cord directed out of the patient's mouth. For bicuspids, align the mesial edge of the bite piece between the first and second premolar contact point. Use the entire length of the bite piece so that the sensor is positioned along the midline. With the bite piece placed on the occlusal surfaces of the teeth to be radiographed, instruct the patient to close slowly. Position the XCP Aura aiming ring close to the skin and align the tube head to the ring. For molars, center the digital sensor behind the second molar with a mesial edge of the bite piece between the first and second molar contact. Use the entire length of the bite piece so that the sensor is positioned along the midline. With the bite piece placed on the occlusal surfaces of the teeth to be radiographed, instruct the patient to close slowly. Position the XCP Aura aiming ring close to the skin and align the tube head to the ring. When the patient closes, allow the sensor to find its own place in the mouth, guiding the positioner into place and again adjusting the vertical angulation if required. Due to the sheer size of sensors and their inability to flex, it is imperative to place the sensor in the center of the mouth. Patient acceptance and comfort will be improved by following this rule. To position the XCP QT universal disposable sensor holders for bite wing X-rays, assemble the bite wing instrument as shown. The red bite piece can be attached to the base from the bottom of the sensor for horizontal bite wings or from the sides for vertical bite wings. For bicuspids, align the anterior border of the digital sensor with the distal portion of the mandibular cuspid. For molars, align the anterior border of the digital sensor with the distal portion of the second premolar. The bite block should be positioned in the mid-palatal area for maximum patient comfort and should rest on the same side of the arch as the teeth being radiographed. The most common problem with bite wing X-rays is overlapping the interproximal contacts. To open the contacts and properly position a bite wing exposure, it is important to position the X-ray beam parallel to the interproximal spaces. If the X-ray beam is not parallel to interproximal spaces, overlapping will occur, resulting in retakes or potentially missed diagnostic information. For distortion-free radiographic images, it is recommended that the paralleling technique be used with the XCP QT universal disposable sensor holders. However, if you are unable to achieve the paralleling technique due to patient anatomy, Dentsply Rin offers the Snap Array DS and Easy Grip digital sensor holders specifically designed for the bisecting angle technique. For either an anterior or posterior bisecting angle radiograph, assemble the sensor properly in the instrument and position it in the mouth with the sensor placed as close to the teeth being radiographed as possible. Then, with the patient closing gently, allow the sensor to find its own place. Then, direct the central ray of the X-ray tube head at a right angle to the imaginary plane that bisects the angle formed by the sensor and the central axis of the teeth being radiographed. High-quality radiographs depend upon accurate positioning and effective positioning systems. You'll get the best results possible by following these simple guidelines and using the long-standing Dentsply Rin positioning systems.
In summary, you should now be able to understand the overview and image capture criteria using the paralleling technique, anterior assembly and positioning, posterior assembly and positioning, bite wing assembly and positioning, overcoming challenges, as well as utilizing the bisecting technique.